Hey Guru Nation, welcome back to the clinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. Keep your questions coming in. So today I took a call from someone who I hope to be a client pretty soon. It's a CRA, and I thought to myself, hey, if one, two, three, four people keep asking me the same thing, I should probably make a video about it. So today's video is going to be, can CRAs own their own research sites, right? And the answer is yes, of course. First of all, this is America, okay? And it's 2017, just about 2017. Like, of course, you can do whatever you want to do, okay? You don't have to just remain an employee the rest of your life. You can own a research site. In fact, way before YouTube, not way before, a few years before YouTube, when I first started in 2005 as a research study coordinator, some of my CRAs actually transitioned off into becoming research site owners. Today, some of those CRAs are networks of mine, people I network with. We exchange study leads, all that kind of stuff. So they're doing well, right? A decade later, they're doing well. Some of those CRAs didn't quit their job until 5 years into being a research site owner. So the answer is yes. CRAs can be site owners. The answer is yes. If you're an entrepreneur at heart, you should be a research site owner. It just makes sense, okay? It makes sense for many reasons. First of all, you already know the operations. The whole part of the process of starting up a research clinic is not screwing up those first studies you get, okay? Because as a new site, your reputation's everything. And if you screw up the first couple opportunities you have, you're probably not going to get very many more, right? So as a CRA, you at least have this advantage going for you that, hey, I already know what CRAs are going to be looking for. I know how to not screw this up. I may not know how to get studies. I may not know how to find doctors. And that's where you're going to watch the rest of my videos to find out and learn strategies. And call me if you need help. 949-415-6256. I will help you out with that. But you at least know how to handle the operations, okay? So yes, it's okay for CRAs to do this. Yes, it's done a lot. I wouldn't be surprised if many of your colleagues, you CRAs that are watching, if many of your colleagues actually have research clinics on the side and they're still working as CRAs, and you wouldn't even know it, okay? I see it a lot. I know it's going on. I think if you're an entrepreneur at heart, you should do this. I don't think you need to quit your job to do it, but at some point, you will need to choose one or the other, I believe. I mean, I know some who have continued to own their own site for 10 years and continue to maintain their job as a CRA. I believe they're contractors now rather than W-2 full-time employees, but it can be done, okay? Just the same way why anyone would open a research clinic, you can open it to have dreams and ambitions of making millions of dollars and having many sites and expanding into phase 1 studies and inpatient studies. Or you might be more comfortable having a lifestyle business that pays you $100,000 to $300,000 a year, doing 3 or 4 trials every year with just one coordinator, or maybe one coordinator and a backup. So yes, it can be done. The question then becomes, because you won't need help with the operations, you will need an experienced study coordinator if you don't want to quit your job as a CRA, because there's no way you can be a coordinator full-time for your site and a CRA full-time. That is just crazy. But you could hire a full-time study coordinator, and you would know better than even I would who to hire, because you're a CRA. You come into contact with study coordinators on a daily basis. You know the good ones from the bad ones. You could probably spot one in like 30 seconds. So the answer is yes. CRAs should, if they're entrepreneurs at heart, and often do, without you even knowing perhaps, own their own research clinics, right? Talk to me if you're a CRA interested in starting your own clinic. It's a lot easier than you might think. 949-415-6256. Good luck. Talk to you soon, Guru Nation. Bye-bye.